Hi, it's Nora Bachman, Pediatric Physical Therapist. In the last video about TMR, or total motion release, we discussed what fascia is and how it could potentially help. So I want to focus a little bit on how we might treat a baby or a toddler using this TMR approach, and also recommend that you try some of it on yourself or a loved one nearby, like an adult who can give you some feedback. So again, just to review, TMR looks at restrictions on motion, which could be caused by some tightness of the fascia, where it may actually stick or adhere or just be stuck for some reason to the fascia of a nearby structure. When we think of fascia as a visual for those who cook in the kitchen with meat, you have probably seen it, this thin layer of tissue on like a chicken breast, for example, where you can actually remove it from the muscle, and that's what's inside of our bodies. So one of the visuals that I find most helpful to understand how this technique works is to think of, let's say you had a Band-Aid on your hand, on the palm of your hand, and it did not allow you to fully extend your fingers. So you're kind of stuck in this position, and that bandage or that adhesive is on this side of your hand, and your fingers just won't go. If you folded that hand over and over and over again, eventually that adhesive would wear off and you'd be able to fully extend your hand. So when we look at some of the motions for TMR, for example, the upper twist position, where you're rotating only the upper body in one direction or the other, what you're gonna do is first look for an asymmetry. So when you're checking on yourself, you should be sitting, have your feet planted, so the only part of your body that's moving is from here up. So if I were showing you, I'd be turning my body, and I might not go as far as physically possible. I'm not gonna pull on something behind me and really try and twist, because when we're looking at kiddos who can't give you feedback, we don't wanna overdo it. So you're gonna turn and see, how far do I go before I kinda wanna stop? Come back to the center and go to the other side and check, how far can I go to the other side? What we're looking for is a clear difference between the right side and the left. So in the example I just demonstrated, or if we show you with our doll here, this little guy can turn to here to the right and only here to the left. It's just not comfortable. In this case, that's our assessment. We're just checking which way feels yummy, which way feels yucky, or maybe just not as yummy. In that case, the treatment is to go to the yummy side, the place that's easier to get to, that feels better, that can go farther. What you're gonna do is either do repetitions. So I'm gonna go to my yummy side, come back to the center, go to the yummy side, come back to the center, or I can just hold it. Go to my end range, or where it feels like the end, not super far, and kind of check in every so often. Do I want to go farther? I can go a little farther. And maybe hold that for 30 seconds, a minute, until your body just says that's enough. You are not doing the treatment to the hard side, which feels counterintuitive, because whenever we stretch, we're going in the opposite direction of movement. But with TMR, it's the position of ease that you're going for. So when you're working with the child, how do you know when you're done? Essentially, they are gonna probably let you know, and you're also gonna really wanna tune in with your hands and your eyes. You really wanna feel what's going on with that kiddo. Are they showing you with their face that they're done, or are they kind of just sinking into it? Does it feel good? Are they starting to squirm? You really wanna just be as in tune with that as you can, and then come back to the middle. Now, the only time you're going to go to that hard side again is if you want to reassess after the treatment. So this is 3 stages we're discussing. Assessment, find the asymmetry. Treatment, treat to the easy side. And then reassess. What does it look like afterwards? To the right, to the left. And generally, you should see more motion to the hard side. I know it sounds crazy, but try it on yourself. And if you are going to try on a kiddo, I recommend you do a very light touch and do less motion than you think you should. Because oftentimes it takes a while to really get a handle on what you're feeling and how much to push. So try it on yourself first, get a sense of how it feels, and just do the treatment if you have a very big difference from right to left. Then check in and see what you find.